How long does it actually feel like that you've been researching health insurance plans? 3 lifetimes? 3.5? Wait, stick around. We're going to take care of that right now. How's it going, everybody? I'm Joey Giangola with Giangola Insurance, and today we're going to go in depth. We're going to basically end your, well, I don't know if we're going to end your search, but we're going to make it a heck of a lot easier. We're going to do that by breaking down their Gold Pathway X PPO 2050-10 plan. Yes, that's a mouthful. Yes, it's an absolutely horrific, horrendous, and god-awful name. But if you actually know their little coded secret, you can kind of actually glean a decent amount of information from that name. But we're going to go line by line and actually tell you how this thing is going to work when you need it to work. And stick around because we're going to jump behind the computer right now. All right, so here we are looking at Anthem's Gold Pathway X PPO 1250/10% plan. And we're just going to go right down the line here and take a look at exactly what this plan covers. So this is their kind of breakdown, their little summary of benefits, if you will. And we're going to start right at the top where it says network name. And I told you, in the beginning, if you know how this thing is decoded, it actually, the name is maybe a little helpful to you. So Anthem, obviously the name of the company. Gold is the level, the metal level of the plan. Pretty obvious there. But Pathway is the name of the network that Anthem is using for this plan. And if you've followed any of the stuff that we've put out over the years, this network of doctors and hospitals is pretty different than the one that you would have with Anthem if you have their health insurance through your employer, any type of small group policy, or even an individual policy that is grandfathered pre-Obamacare, if you will. Those are completely different networks. So this Pathway X, I didn't even get to the X yet, but this Pathway network is what that's identifying. Now the X stands for exchange, which again, as terrible as insurance companies are naming things, exchange is not even what it's called anymore. You probably know it as the health insurance marketplace or Healthcare.gov, basically the place where you go to buy health insurance that is subsidized by the federal government. That just indicates that this plan is purchased or is available on the exchange, in the marketplace, or through Healthcare.gov. They really got to clean that up because obviously I just said 3 different things that you could potentially refer to this thing by, and it's really all in the same spot. And it's a little annoying. I might be a little more on edge today talking about it than normal, but you get the point. So that's what the X stands for. So this is going to really apply to any Anthem plan that you look at too. So it's not just this gold plan. So if you kind of break it down this way, you can kind of tell. PPO obviously is the type of plan, how it functions. So PPO is Preferred Provider Organization. You could see something like HMO here instead, or less likely a POS. Some just different letters that insurance companies like to use to identify plans. And then finally, these last numbers here at the end, 2,500 or 1250, I should say, is your deductible for a single person, and 10% is the coinsurance amount. So we'll get into all of that in just a second, but that's how you break this name down and actually have it make sense. So as we said, the network name is the Pathway X Tiered Hospital Network. Now, Anthem, unfortunately, has gone and made what is already a slightly, or for the most part, pretty complicated situation with their network. They went ahead and even made it a little more difficult because they have a 2-tiered network. So they have tiers 1 and 2. Tier 1 is just, let's treat it as like, traditional networks with any health insurance company. A tier 2 network is going to be something that was in their old network. Maybe they've got a slightly different agreement. Like it's not as good of a strong agreement as tier 1. So just put it this way. If you have a plan with Anthem and it's a tiered network plan, it's an individual plan, you're going to want to do everything you can to stay inside that tier 1 and really only go to that tier 2 unless that's like your only ever last ditch in the world option. And then you can see where it's going to list your individual deductible. You have network and non-network, so that's important to keep in mind here. And then also it says your family deductibles are going to be 2x the individual amount. So you just take 1250, multiply it by 2. You take 5,000, multiply it by 2. So in other words, you're dealing with deductibles of 2,500 and 10,000 for the family. Again, back to network and non-network. If it's in that network, even if it's tier 1 or 2, it's going to go towards that deductible. And then once you meet those deductibles, then the plan is going to kick into the coinsurance. If you're out of network, then you're going to pay that higher amount. So always, always, always just pay attention to the network. Just, I can't stress it enough. Then next down here, you have your individual out-of-pocket limit. So again, they're breaking it up, network, non-network. You can just see the slash line there. This is going to include deductibles, copay, coinsurance, and pharmacy. Again, family amounts are going to be just multiplied by 2. So basically, once everything is kind of accumulated to hit these numbers, then you no longer have to pay for any covered medical services under this policy. So basically means free ride for the rest of the year whenever you hit these numbers. So again, these numbers, if we are looking at a single person, 3,100 in network, 10,000 out of network. If we're looking at a family, then you're dealing with 6,200 and 20,000 for out of network. So big time numbers there. And then you have your coinsurance, which is a pretty decent split. It's 90-10. So Anthem's going to take 90% of the bills after you hit that deductible. And then you're going to have to pay only 10%. Next up, we have your office visit copay for your primary doctor. So this is obviously just your family practice doctor, whatever, got a sinus infection, whatever. You go see this doctor, you're going to pay him a $30 office copay, and there is no limit on that. Some policies might come with the first 2 or 3 visits, you'll get a copay for the year. This one you can go as many times as you want throughout the course of the year and only pay $30. If you need to go see a specialist, well, you're going to pay the full discounted rate that Anthem has negotiated with that specialist, and that's going to go towards your deductible. After you hit that deductible, then you're going to pay 10%. Again, you're going to basically see a lot of this stuff is going to work in a similar fashion where you got to pay towards that deductible. Once you hit that deductible, then you're going to split the bills at 90-10 until you hit your out-of-pocket limit. That's how the out-of-patient diagnostic tests like x-rays and EKGs are going to be handled, in addition to the advanced outpatient diagnostic tests like MRIs, CT scans. Again, paid to the deductible, then split 90-10. Your preventative care, if it's outlined as a preventative service that's mandated by the Affordable Care Act, this plan is going to cover it at no additional cost to you, so it means basically free. I don't know why they don't put free. Maybe free is a little misleading, but let's just put it this way. If you schedule those services, the doctor codes it. They code different services different ways, so a diagnostic visit is going to be coded a different way as a preventative visit. So as long as they code that as a preventative visit, you go see your doctor, you're not going to get a bill for it. Next up, we're going to get into a slightly different scenario here with the urgent care and emergency room care. You're going to have to pay to your deductible, and then you're going to have a $50 copay, and then you're going to have coinsurance at 10%. So you're going to, again, pay the full discounted rate of whatever it costs you to go to that urgent care visit. And then you're going to have a $50 copay. And then you're going to still have to pay 10% coinsurance, whatever's left. So this is definitely something that it was very uncommon, but I'm starting to see it crop up on more and more plans. Can't say that I'm a huge fan of it, but it is what it is. Same thing with the emergency room care. You're going to go to the deductible first, then a $200 copay, and then 10% coinsurance after that. So there's quite a few hoops to jump through there. If you have to go into the hospital, so if inpatient admission, so if you go into the hospital room, this is for maternity care, any type of mental health and substance abuse inpatient treatment, you're gonna have to, again, pay to the deductible first, then you have a $500 copay, and then your 10% for your tier 1, and then as you see, 40% for tier 2, through the coinsurance. Now, if we're talking outpatient surgery, they're going to give you a break. There's going to be no copay, thankfully, in this kind of three-headed monster. But if you're going for something like a knee scope or something that you can, get in, get out pretty quickly on, and in a day's time, again, straight to the deductible. So you'd meet that $1,250 or that $2,500, and then you'd pay the 10% after tier 1, 40% tier 2, and that would be a done deal. Now let's talk about your prescription drug copays and benefits, or pharmacy deductibles, as they like to say, pharmacy retail. And what we're looking at here, again, Anthem has gone ahead and made it a little more complicated than it need be, but so be it. We should be used to it at this point since we've made it this far in the plan. But your retail pharmacy deductible, if you're in a tier 1 or tier 2 medication, you don't have to pay any deductible. So it's not going to go towards your overall medical deductible. If you hit tier 3 or 4, then it's going to actually go to deductible and coinsurance again, just like everything else that we talked about that had that same function. So again, you pay the full discounted rate up to the deductible, then after the deductible, you split the rest 10%. So now if you're staying in the tier 1 and 2 range, again, let's just say generic and preferred brand name medications is what this will probably most likely represent. You're going to be paying $15 for that generic medication. If it's a preferred brand name, you'll pay $40 every time you go fill it retail. So this is over the counter through like a Walgreens, CVS, Walmart, whatever the case. If you're going to fill it for a 30-day supply, that's what you're going to pay. Then you notice here, dental is broken out. Pediatric dental is covered. Adult dental care is not. You would have to add that separate at an additional cost. Again, same with vision. Pediatric vision is covered. Adult vision is not. Again, can also be added at an additional cost. Now, this isn't a hard and fast rule, but on average, you can expect to pay for a dental plan that you're probably interested in buying. Around $30 a month is about a nice average. And for the vision, probably in the $7 to $8 range a month, maybe $9 a month range as well as a decent average. And then the final two things here we have mental health and substance abuse outpatient facility and services. Again, we've heard this plenty of times, but it's going to go towards your deductible, then 10% coinsurance after that. Same thing with physical, occupational, and speech therapy. You're going to only have a limit of 20 visits per year, though, per type of therapy. So obviously, if it's a different type of therapy, you're going to get 20 visits for each type of therapy. But again, those visits will go towards your deductible first, and then into the 10% coinsurance. All right, and there you have it. That was a slightly quick, definitely very detailed breakdown of Anthem's Gold Pathway X PPO 2050-10 plan. So hopefully you have a better understanding of what this plan can do for you, how it's going to work, when you need it to work, and the overall most important things to consider when looking at these health insurance plans. Now what we want to do is, now that you have a better understanding of that plan, there are obviously a lot more to consider. You probably have been considering them. You've probably been wondering how this plan stacks up with others. So what we're going to do is, now I just want you to click right here on my face. And what that's going to do is let you actually start comparing and seeing how this plan stacks up. We're going to I'll kind of hold your hand through the process, and we'll see how this plan works against others from other companies like Medical Mutual, InHealth Mutual, Aetna, and all the different companies that you may or may not want to consider. So let's go ahead, click right here, and we will get to that. But as always, I do appreciate you taking the time to watch this video. I am Joey Giangola with Giangola Insurance. Take it easy, everybody.